Just a second, get all this thing straightened out real quick. How's everybody doing? What's going on? Let's see. Make sure Instagram starts. If it doesn't, then we'll post it later. Here's what it is. Strange. All right, we won't waste any more time. Cool. Anyways, good evening, friends, and welcome to another enlightening episode of the Know Your Pharmacist live stream, brought to you on this brisk November night. I'm Dr. Joaquin Acosta, your guide on this journey of health empowerment. Tonight, we dive deep into the heart of wellness, tackling a foe that's as silent as the falling leaves, but as impactful as the chill in the air. Flu season is upon us, guys. Winter is coming, and knowledge is our power. We'll unpack the latest New Mexico Department of Health flu report, discuss the science of vaccine efficacy, and explore cutting-edge tools designed from our New Mexico Department of Health that are tracking to predict and thus help prevent influenza spread. In our Herbal Wellness Corner, we're spotlighting cannabis research and its promising role in combating opioids. Over in our Full Spectrum podcast, which we had this afternoon, that was brought to you guys by High Horse Cannabis Company. I team up with Bennett Castro as the director of training over at High Horse Cannabis Company. We dive deep into cannabis once a week and get after it. So definitely on Wednesdays, you're always going to see us here on the Know Your Pharmacist live stream promoting that as well. Our community spotlight guy shines a beacon on Little Steps Pediatric, a beautiful beacon of hope for evening pediatric care here in Las Cruces, and Men's Health Minute. We're debunking the myths to deliver the real story behind the man flu. Gratitude to our sponsors, Farm True, High Horse Cannabis Company, The Baked Chicken Farm in Vado Speedway Park. Your support ignites our mission to inform and inspire. Prepare to connect, learn, and lead healthier lives. Let's embark on this journey together, weaving a tapestry of community, care, and advanced science. Here's to health, our community, and the power of staying informed. Let's get started, guys. So, first detections of flu reported by the New Mexico Department of Health here just as the last week came into an update. Boom, boom, boom. So giving everybody the lowdown on that. Guys, flu season, it's just starting to get cold down here in the southern New Mexico area. Maybe northern New Mexico, you got it a little colder on you a little faster. But guys, this is it. We're going to go over and chunk out some of this data here because the Department of Health's already showing first flu cases are reporting. You know what's coming. Granted, yes, winter's coming, but more importantly, the holidays are coming. Thanksgiving is coming, so you're going to be being with a lot of people from a lot of different places. That's the time, between that, returning to school, going back to school or work, and the holidays, you guys, we are just passing around influenza, COVID, so on and so forth. So now, right now is, still a pristine time to get a flu vaccine if you have not gotten one. On our Pharmacist Frontline today, brought to you by Farm True, we want to make sure that everybody has a plan to get a flu vaccine. Basically, got 2 weeks to get immunity. That's about the perfect amount of time to hit Thanksgiving time. Good gosh, this week is a really good week to get it done. Last minute flu shot, guys. So we'll be talking about that here today. Jumping into the next tab, the New Mexico Department of Health Influenza and Respiratory Disease Report. So, looking specifically for our little neck of the woods down here, Doña County, you can see Bernalillo County definitely a little bit, more aggressive. But the New Mexico over the week of October 22nd through October 28th, which is currently the most recent summary of activity from the Department of Health. As noted here, New Mexico influenza-like illnesses activity is currently at 3.9% of patient visits statewide. below the New Mexico ILL baseline of 6.0%. One of the 5 New Mexico health regions is above the New Mexico baseline. So, right now the United States ILI is 2.7%, below the national baseline at 2.9%. Seasonal influenza vaccination as of about almost 2 weeks ago is only at 15% of those eligible. So again, where we're looking at this activity of flu is about to just really ramp up, and we're looking at the triple virus season of flu, COVID, RSV. Guys, get those shots. This one's the easy one to get. If anybody had a preference as to, well, I'm not going to get a COVID shot because I've gotten too many of those, well, get your annual flu shot, right? Perfect. Perfect time to encourage that. I absolutely, as a pharmacist, strongly recommend getting the updated COVID booster as well and following your recommendation on that. But, you're going to definitely just noticeably see the numbers dropping there. Annual flu shots are not going to go away, guys, and winter's coming. Flu is coming. So check out those numbers. We'll be zooming in on all that stuff and taking a look at, where it's about to peak in the state of New Mexico. Again, between mid-December, that's early mid-December, look at that rise. It's right there, guys, after Thanksgiving. So that virus can incubate, get back into the schools and workplaces, spread, peak, boom, Christmas time slowly starts falling because everybody already had it. So we're already expecting this, winter's coming, flu, COVID, RSV. But we just want to be able to hang out with our families and have a good time and not have everybody sick. Why we're talking about this today is a really great time. So moving on, guys, talking on our Enlightenment, our vaccine effectiveness. How well do flu vaccines work? How effective are they? Let's look at some CDC data right now, guys. Recent studies show that flu vaccination reduces the risk of flu illness by between 40 and 60% among the overall population during the seasons when most circulating flu viruses are well matched to those used to make the flu vaccine. So again, as long as the viruses are made correctly, or the vaccine antibodies are made correctly, then you've got that 40 to 60% chance. You don't have the hit every single year. They're doing better against influenza B and influenza A, H1N1, and offer less overall against H3N2. So again, the varying subtypes and so on and so forth, the matches over time have shown this. But guys, I like the number, the 40 to 60%, somewhere in there, generally protected if you're getting that flu vaccine. Again, so I think that's where we really look at the fact from the fiction there. You are literally really decreasing your chance at even contracting, the flu. And then again, you're really taking down all the, chances of having some terrible symptoms from the flu or even hospitalizations. Like, who are our most vulnerable population, guys? Our adults over 65, our infants, those with autoimmune diseases, HIV, so on and so forth, are our populations who are absolutely, at risk for more serious illness, hospitalization, and even death during this time. So those are the people, of course, we really need to make sure get vaccinated. But again, you can help stop the spread even to your loved ones or anybody in those categories by getting one yourself, even if you don't feel like it's going to knock you out and you don't need to do it, right? So those are all the reasons, again, as a pharmacist, why I do highly, highly, strongly recommend that and encourage that from each and every single one of our viewers. Everybody, just 6 months to whenever you can get it done for sure. So we're chugging along smoothly today, guys. It's hump day. It's Wednesday. We're talking, making sure we know what's going on before winter is coming. We know the main good stuff coming out of that. But what else did we hit today? Me and Bennett over at High Horse Cannabis Company popped off on opioids and the opioid crisis. It was a great one. Got the link here in the show notes here, the description. But it was a good episode. We went all the way in on the opioid advertising in the early 90s, how the whole thing ended up of creating us as a country. United States of America consumes 80% of the world's opioid population. for only being, or 80% of the world's opioid supply for only being 5% of the world's population. How insane is that, guys? We went and digested that. Every Wednesday, Full Spectrum podcast on YouTube. High Horse Cannabis Company, nice cannabis-friendly, platform for us to talk about it there. That's why we don't hit it every single day from this one. Anyways, guys, we're moving on to our community spotlight, sponsored and brought to you by the Baked Chicken Farm. Wanted to share the after-hours clinic of Little Steps Pediatric, their night clinic, guys. Perfect time of year for that. Sick visits, sports physicals, flu and COVID testing here in town from 5 to 9. Great alternative to urgent cares. And we know our urgent cares get over flooded. Granted, go to the urgent care before the ER, especially for little things. But, for your little ones, tailored care, especially for the little ones. This is a great opportunity here in town that's now opened up off of 1130 Commerce Drive. I'll sure be using it if I have to, absolutely. So anyways, let's jump on the last thing, Men's Health Minute. Anybody ever heard of the man flu? I think it's an interesting concept, right? Anyways, but apparently it's a phrase used to denote acute rhinosinusitis in men. It's called ARS. Technically, a type of upper respiratory tract infection affecting the nose and paranasal sinuses. The man flu, aka, does not exist. So if anybody ever says the man flu is a thing, officially to debunk, the man flu is not a thing. Gender-specific secondary analysis of a prospective randomized controlled trial for even acute rhinosinusitis, guys, does not conclude that men are affected any different than women from flu or ARS or anything else. So, doesn't happen. A little bit of comic relief for that today. And the man flu, otherwise known as, it doesn't exist. It's debunked. Other than that, it's quick. Happy Wednesday, hump day, guys. We'll see you guys tomorrow. Get a plan to get that flu shot. Much love.